No one wants to get sick during the flu season, but should certain people be forced to get the flu shot? It's a debate that's heating up among healthcare professionals as calls grow for mandatory vaccination. Christina Stevens reports.
This video has been made to tell you about the vaccine and what you can do to protect yourself and all those around you from the flu.
Every year, the push is on for people to get the flu vaccine. But now the Canadian Medical Association Journal is taking things one step further with a call for mandatory flu shots for all hospital healthcare workers.
The vaccine is now relatively effective, and that the influenza virus is circulating quite prevalently in the hospitals, still responsible for between 4,000 and 8,000 deaths in Canada. Many of them are occurring in hospitals. A proportion of them acquired in hospital.
But the union representing some hospital workers says that's taking things too far, that getting the flu shot should be a personal decision.
But they care very much about the patients. They do watch the scientific literature. They don't believe, perhaps, that there is enough evidence, to require the mandatory vaccination.
One recent study suggests flu shots are, on average, effective 60% of the time. Proponents point out that some years, though, it's been as high as 85% and that side effects are minimal.
All things considered, it's a very reasonable action to want to start looking at mandatory vaccination. The challenge is going to be actually putting it into action.
This year, BC set new rules requiring healthcare workers to get inoculated or wear a surgical mask at work, something the nurses' union is fighting. Both sides in the debate at odds over workers' rights versus those of patients. Christina Stevens, Global News, Toronto.